One way the physical therapist can help the golfer with the golf swing is to identify deficits in range of motion and strength that affect their ability to perform an efficient golf swing. When we look at the golf swing in general, Todd's going to demonstrate here for us. We initially look at his setup. What we want to see is a nice strong stance, legs a little bit bent in an athletic position, just as you would imagine a shortstop in baseball be positioned. This allows his legs to be ready to contribute to the power needed to perform an efficient golf swing. So now we're going to take a look at the backswing. As he goes into his backswing, the main goal we want to see achieved is that the lower extremities stay fairly stable as the trunk rotates around. This enables the club head to get back as far as he can and generate club speed and power as he comes down through to strike the ball. Typical flaws we see in the golf swing often can be picked up in the backswing. If we watch Todd go back into his backswing here, a flaw we might see in someone's lower extremity is that this back leg might go straight. This might be his way of compensating for lack of strength in the right leg, or a lack of motion in the hip, or his inability to turn his shoulders. The golfer will straighten the leg to help get the club head back. The problem with the straightening of the knee is that as soon as he straightens that knee when he goes into his backswing, he loses all power that can be generated from that right leg to help drive his body through the swing. So what we want to see is as he goes into his backswing, is we want to see that he maintains that bend in his right knee, his shoulders turn around that fixated point, which loads the right side of his body and the muscles on that body needed to generate power to bring the club head through the ball. Another common area of the body we see injuries in a golfer is at the elbow. So as he goes into his backswing here, the compensation we'll commonly see is that this front elbow is bent. Typically what should happen is this elbow should stay straight as we go into the backswing. When this bends, we are now putting extra stress on the muscles around the elbow joint to bring that club head through. So as he comes through to strike the ball, now the elbow has to extend again, and doing this repetitively can cause an overuse injury at the elbow, on the outside or the inside of the elbow as he strikes the ball. The most important element of the golf swing, though, is to be able to create an efficient shoulder turn. So as we go into the backswing, what we want to see is that these shoulders can rotate freely around the fixated lower body to create that turn and bring the club through to strike the ball. If someone is lacking this rotation, then this can ultimately cause swing faults in the other parts of the body, where the knee can go straight, the elbow can bend as the golfer tries to compensate for this lack of rotation. An exercise the golfer can do to work on this rotation would look like this. What you want to do is make sure you maintain that nice posture that you have at the dress with your knees bent, slightly flexed at the waist, and then you simply work on creating that shoulder turn. Trying to keep your belt buckle facing forward if you can, keep your knees bent, and go to that end range. And then holding that for about 30 seconds, work on stretching the muscles and increasing the mobility in your spine needed to create that motion. This is just an example of a few of the common swing flaws we see when golfers present to us here at Body and Physical Therapy. Being able to identify these and address them in the proper way will help you be able to golf without pain and may also help you ultimately lower your score.